Hello and welcome to Know Your Numbers Part 1, Interpreting Your Lab Results. My name is Lauren and I'm a registered dietitian with Rock Valley Health. Here today to give you an in-depth overview of the lab results that you get completed during your health assessments with Davenport Fire that are in partnership with Rock Valley Health. So by the end of this video, hopefully you have a better understanding of what those lab results mean and how they relate to your overall health and wellness. So let's get started. So the first lab value is called a CBC or complete blood count. This test is helpful for diagnosing anemia and infections that may affect your blood cell count. It can also help determine the causes of a variety of symptoms, anything like weakness, fever, abnormal bleeding or bruising, or any swelling or pain. So the complete blood count actually includes 5 different lab values. The first one being red blood cells, which carry oxygen throughout your body. The second is white blood cells, which help fight infections. The third is hemoglobin, which is a type of protein in your blood that carries oxygen. The fourth being hematocrit, which is the amount of red blood cells in your blood. And the last one is platelets, which help your blood to clot. So, red blood cells have different ranges for men or for women that you'll see on the screen here. And if you have low red blood cells, this is usually a sign of anemia, which is most likely caused by low iron levels, and you usually feel weak or tired if anemia is the case there. And a high red blood cell count, this is called erythrocytosis. This can actually be a potential sign of heart disease. So the next lab value as part of the complete blood count is white blood cells. You'll see the normal range on the screen there. So if you have a low white blood cell count, this can be caused by certain medications, or leukopenia is an autoimmune disorder that some people have that can cause this number to be low. On the other hand, if you have high white blood cell count, this is usually caused by any sort of infection or inflammation. And again, certain medications can cause this, or after really intense exercise, your white blood cell count could be high. And the next value as part of the complete blood count is hemoglobin. You'll see the normal ranges on the screen here are different for men and women. And a sign of low hemoglobin, this is again a sign of anemia. Those low iron levels, feeling weak and tired is usually the most common symptom of that. And having a high hemoglobin is again the erythrocytosis diagnosis term. And again, this is a potential sign of heart disease. So hematocrit is one of the next values as part of the complete blood count. You'll see the normal ranges again are different for men and women, and they're listed in percentages. So a low hematocrit, again, that similarity between hemoglobin, it's likely a sign of anemia with the low iron levels and feeling weak or tired. And a high hematocrit, again, associated with a high hemoglobin, the erythrocytosis diagnosis term, again, being a potential sign of heart disease. So we have some questions throughout the video to give you guys some knowledge breaks to test your knowledge about all of these lab values. So our first question is, what is the most common cause of low red blood cell count, hemoglobin, and hematocrit? Is it A, taking antibiotics, B, blood loss, C, anemia, D, infection or inflammation, or E, intense exercise? All right, so the last value as part of the complete blood count is platelet count. So you'll see again the normal ranges are different for men and women. And low platelets, this is called thrombocytopenia. This is usually caused by excess bleeding. It can also be caused by antibiotics, excess alcohol use, or any kind of infection. High platelets is called thrombocytosis. This may cause blood clots, and because your blood can clot a little bit more because of having a high platelet count, this can cause you to be at increased risk for heart attacks or stroke, and also can be caused by anemia or infection. So, our second question here to test your knowledge is if you have a family history or current diagnosis of cardiovascular disease, which of the following lab values may be high? Is it A, red blood cells, B, hemoglobin, C, hematocrit, D, platelet count, or E, white blood cells? All right. So, as a registered dietitian, I wanted to give you guys some nutrition tips for anemia if you find yourself in that situation with a low red blood cell count, hemoglobin, or hematocrit, or have gotten this diagnosis before from a doctor. So, again, it is the most common cause of the low red blood cells, hemoglobin, or hematocrit, usually caused by low iron levels, and this is called iron deficiency anemia. Iron helps carry oxygen through the body, and so if you have a low iron level, that can cause you to feel weak and tired and have low energy. So the normal iron ranges you'll see here are different for women and men. They're a lot higher for women and even higher if you're pregnant. So these are just some foods that are really, really good sources of iron that you want to focus on if you're anemic or have low iron levels based on those blood cell count numbers. So whole grain cereals, any kind of whole grain products, oatmeal, beans, any lean proteins like beef, chicken, seafood, pumpkin seeds, potatoes, spinach, things like eggs and nuts, tomato sauce, raisins, asparagus, Brussels sprouts, and soy milk. So there are a variety of foods that are high iron sources that you can include in your diet. And just some last few nutrition tips for anemia here. Animal sources of iron, things like meat and poultry, are actually better absorbed versus plant sources. And foods high in vitamin C, things like citrus fruits, potatoes, dark leafy greens, those actually help absorb iron rich foods better when you eat them together. And then it is important too to minimize having coffee or tea with your meals because this can actually decrease iron absorption. And also, there are iron supplements or multivitamins that have a good amount of iron in them to consider as well if you don't think you're getting enough of those iron sources from food. So, our third question here: which of the following foods is best to consume if you have low red blood cells, hemoglobin, or hematocrit? Is it A, coffee or tea with meals, B, citrus fruits, C, white breads or pastas, D, red meat, or E, oatmeal? All right, so that concludes part one of our lab value overview. Thank you guys for watching. I hope this video has been helpful for you to learn a little bit about what your lab values mean and how they impact your health and wellness. Next up, you guys are going to test your knowledge about those questions that we went over in a post video quiz.